Three, two, one. You can start now, sir.
Okay. So good morning, everyone.
Sir, you are in a mute.
Alok, you're on mute.
So good morning, everyone. On behalf of Cardiac Division from Alembic, I want to welcome all participants for today's volumeter webinars. Today's topic is lifestyle tips in hypertension management. Now I am pleased to introduce our speaker, Dr. Debasis Pathi, professor from Kim's Hospital, who will guide us on simple, practical lifestyle measurement for better BP control. So thank you, sir. Now I am going to share the screen. So sir will deliver his valuable talk.
Thank you. Can you please help me with the slide?
Sir, is my slide sir visible?
No, no, not visible.
Yes. Yes, yes.
Okay, let me see. Right, right. Now it is visible.
Okay, sir. Over to you, sir.
Thank you. Okay, good morning, everyone. So, today's talk is on understanding and controlling blood pressure and lifestyle modifications that help us manage blood pressure better. So, next slide, please. There is a okay. Fine. So extra salt intake increases blood fluid volume and putting extra strain on the heart and leading to high blood pressure. So very basic mechanism for hypertension. In the context of extra salt in the diet is extra salt causes fluid retention, and that consequent in as a consequence of that that increases blood volume and it increases the preload and heart works harder, and that results in a rise in systolic and diastolic blood pressure. So controlling salt intake and body fluid volume is a key to protecting your heart and managing blood pressure. So as we know that the right BP target helps protect organs and reduces the risk of heart disease and complications in the long run. So adults with hypertension, the target is less than 130 over 80 millimeters of mercury. And adults with hypertension with comorbidities like diabetes, CKD, cardiovascular disease, the target is systolic 120 to 129 and diastolic of 70 to 79 millimeters of mercury. So one of the key components to blood pressure management is diet. So the DAS diet is rich in nutrients and can help lower blood pressure and support health. So the takeaway points are eat more fruits, vegetables, and whole grains, which help provide essential vitamins, minerals, and fiber. Choose a low-fat dairy, nuts, fish, and poultry, good source which are good source of protein and healthy fats. We have to cut down on red meat, sweets, sugary drinks, which help reduce calories, sugar, and unhealthy fats. And we should have enough of potassium, magnesium, calcium, and fibers, which support healthy blood pressure and overall health. So even a moderate reduction in salt intake can significantly lower the risk of heart disease, especially in people with high or difficult to control blood pressure. So the salt intake has to be limited to 5 grams per day. And some of the indirect sources of salt are processed and fast foods, which are very high in salt. And alternatives are potassium rich salt alternatives, which can be taken if it is appropriate for the patients. Next slide, please. As part of our lifestyle modification, physical activity is quite effective in reducing blood pressure. So regular physical activity helps lower blood pressure, improves overall heart health. Walking, jogging are good aerobic exercises. 30 minutes on most days and 300 minutes per week of activity can result in a healthier heart and lower blood pressure. Next slide, please. Managing stress through yoga, deep breathing, and meditation can help lower blood pressure and improve overall well-being. Yoga helps reduce stress and support blood pressure control. Deep breathing exercises lower stress, and meditation helps in providing calmness and focus. So, managing stress is a key component of controlling blood pressure. Next slide, please. A healthy gut flora can reduce inflammation and may help lower blood pressure. Eat more fiber from fruits, vegetables, and whole grains. Include yogurt and probiotics. Add probiotic and probiotic rich foods. Cut down on processed foods, excess salt, and saturated fats. Good habits, along with medications, can help control blood pressure and protect your heart. Avoid alcohol. Follow lifestyle changes with prescribed medications. Be very particular about taking your medications in time. Avoid smoking and energy drinks, which can raise blood pressure and harm heart health. We have to limit caffeinated and sugary drinks because they can negatively affect blood pressure and heart health. Thank you.
So thank you so much, Dr. Debasis Pathi sir, for the informative session. Now we will begin our question and answer session. Participants can share their questions in the chat box, and I will read the questions for behalf of. So, so doctor, one participant is asking, how much salt should we take daily, sir?
And that depends, but as a principle, you should not consume more than 5 grams of salt in a day, directly or indirectly.
Okay, sir. Thank you, sir. Sir, another participant wants to know, can BP become normal only with the lifestyle changes?
Yes, it depends on the baseline blood pressure at the time of diagnosis. But in few cases, hypertension can be reversed when the underlying cause is treated.
Okay, sir. Thank you so much, sir. Sir, another question is, what type of exercise is best for BP control?
Uh, for
Sir, what type of exercise
is for
for BP control, sir?
blood pressure.
Helps.
Aerobic exercise, walking, jogging are very good for blood pressure management. You do not need to do very extensive exercises. Basic jogging in a park or walking around the house is good enough. But it has to be done for at least 30 minutes a day.
Okay, sir. Sir, another question is, which Indian foods should I avoid in BP control?
Uh, okay. It is not the food, but the add-on salt that we consume. So pickles should be avoided. Papad should be avoided. Some bakery products should be avoided, and the habit of putting extra salt in curries and all that should be avoided.
Okay, sir. Thank you, sir. Sir,
Thank
another participant is asking, is tea or coffee harmful for patients with hypertension?
you. Tea, not so much. Is caffeinated drinks can affect blood pressure by increasing the heart rate. So there is something called a caffeine window where you can consume coffee. Try to cut down on coffee.
Okay, sir. Sir, another participant is asking, can I stop BP medicines once my BP becomes normal?
No, it has to be continued. The dose may be titrated depending on your consultant, but do not abruptly stop your blood pressure medications.
Yes, sir. Thank you, sir. Sir, another participant is asking, how important is weight reduction in controlling blood pressure?
This is very important. Obesity is a independent cause of hypertension. So yes, we have seen in many patients, and it is documented also. BMI improvement leads to improvement in hypertension. Yes.
Okay, sir. So the last question from our side, sir. What is the correct way and best time to check BP at home, sir?
Uh, there are very specific guidelines on monitoring blood pressure. Home monitoring is should be done when the person is calm, relaxed, should not have consumed stimulants like coffee prior to monitoring. The cuff should be tied properly, should not be wearing any tight clothes. Feet should be firmly on the ground, and the monitor should be at the level of the heart. You can take multiple readings and take average of the values.
Okay, sir. Sir, this is the last question from our side. Okay, thank you so much, sir, Dr.
Thank
Debasis
you.
Pathi, sir, for your valuable guidance and insights. So I also thank all participants for joining today's webinar and making this successful. Thank you so much, sir. Stay healthy, stay active, sir.
Thank
Thank
you.
you so much, sir. Thank you for your valuable time, sir. Have a great day, sir.